Information, you'll notice we're connecting online, no guests here at the TV station. Our first guest is Marlies Perez, Division Chief for the California Department of Health Care Services. Ms. Perez, thank you for joining us. Let me ask you the first text, let's get right to it here. How is coronavirus impacting the opioid epidemic?
Yeah, so we're really concerned at the Department of Health Care Services. As we all know, we've been facing this public health crisis with opioids over the last few years. And one of the concerns with COVID-19 is while we're all physically distancing, people are in isolation. So the tendency is for people that are abusing and using opioids for those to rise.
Okay, next one coming in, Marlies, is are opioid overdose deaths decreasing since people are physically distancing themselves, or are people who are having opioid issues, that's physical distancing is not that important?
Yeah, so the concern is a lot of individuals that do overdose with opioids are using in isolation. So once again, it can even happen when folks are home, but they go into the bedroom and they overdose. Another concern is the rise of fentanyl, and we've seen that on the East Coast, and that's really been impacting us on the West Coast. And fentanyl, it just needs like a few little grains, like the size of salt, for an individual to overdose. And we're seeing that not only in opioids, but also in methamphetamines. And even we've heard of some of that being in marijuana. So It's a really concerning time for us.
Yeah, I can imagine. Okay, the next one is certainly a broad issue, which will affect a lot of people. This text coming in now. I've heard alcohol use is on the rise. Is that true? And I would say in previous shows, Marlies, we've heard anywhere from 50 to 77% rise in alcohol purchases at liquor stores and say, let's say, a Target as well.
Yeah, so as we have been really focusing on the opioid epidemic nationwide, our largest number of people that die is from alcohol use. So once again, this is concerning a lot of people. If they're anxious with COVID-19, once again, if they're in isolation, maybe they're even by themselves, they may want to, use some alcohol thinking that that's going to help them. Unfortunately, it's a depressant. And so it really can be very dangerous at this time because people may already feel anxious and depressed, have that alcohol, and that could lead to other issues.
Good to know. Next one coming in, Marlies, is how can we tell the difference between enjoying drinking versus abusing it? I wouldn't assume it's by the amount of drinks you have. Is it how how strong they are, how your tolerance to it?
Yeah, so that is such a great question. So there's really different levels. There is first individuals that some folks can just go have a drink and be fine and go about the rest of their day, but others can really get a dependence on it. So if you start seeing that you're really depending on it and you're starting to crave that could be one of the first signs that you may be developing an alcohol use disorder. So there's a lot of great assessments. You can work with your county behavioral health department and call and get an assessment just to check. Okay,
we're talking with Marlies Perez. Next one coming in is someone I know is using opioids. What should I do?
So the first thing that you can do is, I just want to be clear, there are opioids that doctors prescribe that individuals should be taking, but according to what the doctor's recommendations are. But if they start using more opioids or once again also develop that dependence, then you need to talk to them. So the biggest issue that we have with individuals with a substance use disorder is the stigma. We don't want to talk about it. We're afraid, to approach it. So really the best thing you can do for your friend or your loved one is talk to them about it. Say, hey, I see that it looks like you're using, more alcohol or opioids. What's going on? And then if you need to help them, get some assistance for that.
Okay, next one coming in for you, text, is are treatment services still available during the COVID-19 emergency for opioid addiction, alcohol, or anything that people are struggling with?
Yeah, so we at the Department of Health Care Services, we license the treatment providers, and so we've been working with them to some of their services are available via telehealth or telephone. We still have our residential facilities are open as well. So yes, treatment services are available, and coverage for services that are provided with Medi-Cal are also available. So once again, you can actually go, we have a website called choosemat.org. And there's a treatment locator there. So you can go to that treatment locator and find a facility if you need some assistance.
Okay, we'll be back with more of your text questions for Marlies Perez just ahead. 916-321-3310.
This week, The View from Home is live and all new. And later today, we're checking in with Nathan Lane. Plus tomorrow, the fabulous Billy Porter is bringing his view. This week on an all-new View on ABC.
If you've worked too hard for too long and can't work anymore, you may be getting state disability benefits, but you could be missing out on Social Security, disability, or workers' compensation. I'm Rob Smolich. Since 1969, our law firm has helped people win workers' compensation and Social Security disability. We're a law firm for hardworking people.
Call Smolich and Smolich, toll free, 1-800-443-1345.
The world is going through so much right now, but one thing remains the same. You can lean on Molina Healthcare. If your income has changed due to COVID-19, you may qualify to receive financial assistance for some or all of your health care. Plus, Molina helps cover COVID-19 related medical costs and provides the benefits you and your family need to stay healthy. So get the most from your health plan. Lean on Molina. Visit meetmolina.com today for details. That's meetmolina.com.
You want a fresh-smelling home, but some air fresheners use heavy, overwhelming scents. Try Febreze One, a range of innovative air fresheners with no heavy perfumes that you can feel good about using in your home to deliver a light, natural-smelling freshness. Febreze One neutralizes stale, stuffy odors and releases a subtle hint of fragrance, like bamboo or lavender and eucalyptus. To eliminate odors with no heavy perfumes, try Febreze One. Brand power helping you buy better.
In these uncertain times, you need facts, not fear, when it comes to breaking news, sheltering-in-place updates, the economy, and how to stay safe. For facts, not fear, download the ABC10 app. ABC10, we stand for you.
RC Willey has essential items, including appliances, in stock. Shop online at rcwilley.com.
Facts Not Fear. We're back with Marlies Perez, Division Chief for the California Department of Health Care Services. Text your questions, 916-321-3310. Next one coming in now. I just became unemployed. How do I get on Medi-Cal?
Yeah, so in order to establish your Medi-Cal eligibility, you can work with your county, your local county department, and they can get you signed up for Medi-Cal services. If you're not sure where to go to at your county, you can also go to our website. That's dhcs.ca.gov, and you can learn about signing up for Medi-Cal.
Okay, good to know that. All right, next text coming in for you. I have a lot of anxiety, concerns about COVID-19 and everything that surrounds that. What do I do about being anxious?
Yeah, so first of all, just really understanding that that's normal. All of us, we've been through a lot of change. There's been a lot of experiences of loss, of either events or big things going on in folks' lives, like weddings or graduations that, we can't do in a normal way. But if you are having a lot of anxiety and you're just not sure what to do about it, there is a lot of toll-free lines that you can call. One of them is sponsored by the Substance Abuse and Mental Health Administration, and that number is a free number. It's 900-825-5990, and that number you can call 24 hours a day, 7 days a week, and just talk to somebody about your anxiety.
Okay, we've just talked about anxiety. Let's take it to depression with the next one. I feel depressed due to physical distancing. Would you put that in the same category as seeking treatment, or would that be different?
Yeah, so once again, you could call that distress line. There's a lot of other hotlines we have available on our website as well, to just see if maybe you need a little bit more assistance. There's, with depression, there's some folks that have seasonal depression. It could be events such as COVID-19, and there's no shame in that. So really understanding there's a lot that's impacting us right now with COVID-19. So really just reaching out just to see if maybe you need a little help. I'd highly recommend that. So there's lots of services available for folks, but don't be shy. Just pick up a call get an assessment, talk to somebody and see if maybe you need a little bit more assistance.
Would you have any data right now, Marlies, with what's gone on the last 2 months of how many more people have fallen into alcohol issues, opioid dependence on something, depression, anxiety, and it's understandable considering loss of job or home. How bad has it gotten?
It's really hard to tell right now as in real-time data. We are hearing a lot of reports. Just in general, we have a tremendous amount of data around mental health and substance use disorders. And one of the concerning pieces of that is a lot of people that need treatment now aren't even accessing the services. Yeah. And a lot of that is due to stigma. And there's a lot of shame in these diseases. And so what we can all do is just help encourage one another during these times to seek some help, that it's normal, it's okay. The big concern with these diseases is isolation is a huge factor. Yeah. And so even individuals in long-term recovery, we need to reach out and make sure they're okay.
Yeah, it's another thing is isolation too. I mean, it's a perfect storm right now. Marlies Perez with the state, thank you so much for your good tips and advice. We appreciate your time today.
Great, thank you.
Thank you. Up next, Carly Knobloch.